Well, more women are having babies later in life than ever before, which also means more women are having trouble getting pregnant. Many of them turn to modern medicine, but they're also turning to the ancient technique of acupuncture.
And I'm going to start with some needles in the feet and the hands and also in the ears that are helpful for relaxation. The needles are so thin that you can barely feel them.
Once a week, Kyra Ramirez goes under the needle in hopes of having a baby. She's preparing herself for in vitro fertilization later this fall.
And so we're working on regulating my cycle, regulating my periods, and increasing my egg quality.
She's been working on that with licensed acupuncturist Julie Chang for 6 months now. Chang specializes in fertility treatments and claims she has a 60% success rate with her patients.
Acupuncture works by increasing blood flow to the reproductive organs, providing nutrients and oxygen and balanced hormones.
And the other benefit? Reducing stress.
With the acupuncture and the fact that I have a half hour or 45 minutes of quiet time to myself and knowing that I'm healing my body during that time, it's really wonderful.
Wonderful, but not a sure thing. Millions of dollars are spent in the U.S. on the pursuit of pregnancy. An estimated 1 in 6 couples experience fertility problems. Many over the age of 35 undergo insemination and IVF, which could cost up to $15,000 a procedure. And the tide of medical opinion is changing in favor of acupuncture as a frontline therapy for infertility.
The data that's coming in now is very promising. And I think the risk from acupuncture is so low and the potential benefit is there that for most patients the risk-benefit ratio warrants trying it.
And trying it is not cheap, but Dr. Chang puts it into perspective.
The entire treatment to really improve the odds of conceiving is $1,000 to $2,000 for 3 to 6 months of treatment, which is a drop in the bucket compared to many medical procedures.
And as you just heard, that entire treatment lasts up to 6 months. Up to 6 months, costs up to $2,000, but the payoff can be priceless. Joining me now is Heather Astania, now almost 7 months pregnant. Yes. Welcome.
Thank you.
And you used acupuncture. You tried IVF, in vitro fertilization, twice unsuccessfully. The third time you used acupuncture, and here you are, now you're pregnant.
Yes.
Do you think it was the acupuncture, or did you just get lucky?
No, I absolutely do think that it helped. We had been trying for about 3.5 years, and we've tried all kinds of things, and after 2 failed IVFs, we said there's got to be something else that we can add to this, and we looked into it and thought, well, acupuncture has got some merit going for it, so let's try it.
And you say, let us try it, because not only did you go through acupuncture, your husband did as well. Can you talk about that?
Yeah, actually, we thought it would be really good for my husband to do it too. He's a pilot, has been flying for about 25 years, and is, subjected to a little bit more of the elements than most of us are. So we thought, there's probably some need for him to get back into it, and so we both started doing acupuncture.
And real quick, what was it that you think changed from the acupuncture? How did it improve your chances?
I think one of probably the core things was just the stress relief associated with it. Fertility treatment is very intense, very rigid, very clinical, and you get to the point where you're just pretty wound up. So we thought, acupuncture would help reduce the stress levels, also help get our bodies back into alignment. So.
And that's what Steve was talking about earlier, was that stress.
Absolutely.
Now, can we show San Diego a picture of your child?
Certainly.
We don't know if it's a he or she
no,
just
not
yet. Because it's going to be a surprise, but look, I think he or she looks just like you, Heather.
Oh, thank you.
And we call this the $60,000 baby,
yes,
the miracle
this is our
baby.
Miracle baby.
Wow. Well, we are so happy for you and wish you the best of luck for the rest of your pregnancy.
Thank you so much.
Oh, thanks for coming on.